place you want to put your amalgam is down in the box area. So I'm going to use the small carrier, and I'm going to put a small amount. You don't even have to push the whole amount in there. Put a small amount. Make sure that you're using the right size condenser that fits down in there, and you must use your mirror to see what you're doing, okay? So I'm using the mirror, I'm looking in the mirror, it's very tricky. Use your instrument to push that amalgam down in there. Condense thoroughly. Push against the wall. Push against the buccal wall, the lingual wall, okay? Make sure that that's thoroughly condensed down in that box area. So right at this point, my box is completely level with the rest of the tooth, the floor of the tooth, okay? So now at this point, I can put the rest of my restoration material in there. And when you're putting it in, don't just drop it out. Like, use this as a condenser to kind of keep it in, okay? Especially when you're working in the maxillary arch. The only thing is when you're using that metal that comes out of the carrier as your condenser, you can't swipe as that's out because it's going to keep pushing your material out. So, I don't know why this is falling out there. Very, very important that when you're putting your material in, you're not moving your matrix band all around. And what I'd like to try to do is get my amalgam into that, still concentrate on the box area, and then the rest of the floor. Just kind of keep it going in level and pack it into the walls. Very important. It's not a flowable composite. It's not just going to go there unless you put it there. Don't do 2 increments at a time. It's too much and you're not going to condense it properly. Once you start getting up to the top of the prep, you can, if you want to use like a larger condenser, you can. But the size that I have is pretty good right now. Working well. You want to use overlapping strokes, and you want to use a good amount of pressure. Don't waste your amalgam. If it starts pushing out and away, like, use your instrument to push it back where you need it. Remember, you've got to pack this box area, this marginal ridge, nice and tight, or else it's going to fall apart whenever you go to take your band off. When you're condensing, you can move that out of the way unless you like leaning on it, it's fine. When you're condensing, you have to condense into the walls. See, it's getting a little shiny because that's the mercury rising to the top. One double spill of the amalgam should be enough, but can you please go mix me another one? Thank you. But I want to make sure that you guys are overfilling, so if you don't have enough, you need to make sure that you get more. You don't have a whole lot of time. This is regular set, but you don't have a whole lot of time to mess around. So work quickly but thoroughly. Push the material where you need it. And I want this to be, thank you so much for mixing that. I want this to be level and overfilled. Right now it's still underfilled. Oh, I'm gonna put it in, awesome. I was like, where is it? It's empty. I'll have to remember. I don't like this amalgam. It looks grainy or something right now. Like, it's not normal. Okay, so it's really soft, and you would, like I told you before, just make sure that you're not, right now, when you get it to the level that you want, you don't want to pack it really hard. You want to be thorough. Angle the condenser around the margins and always make sure you have a fulcrum. Use your mirror to make sure your margin is high enough. Now, since this is pretty soft, I'm going to be somewhat gentle whenever I'm burnishing it, but I'm going to burnish with the large, wide end. Do not use the point. Okay? So right now I'm going to burnish gently over the restoration, back and forth, gently over this margin. The margin is the trickiest part here because if your band isn't high enough, if you didn't condense it properly, if you didn't burnish it right, then you're not going to end up keeping that margin. It's going to break. So when you're starting to burnish, you can start putting your faucet in there a little bit. See that? Now what I need to do is I need to get this extra material out of the way. So I'm going to get my Explorer. This band, I don't know if it's a Tafelmeyer that was stiff or something and it's not catching it right, but thank you. I don't feel comfortable though. You don't have your gloves on and you're working with mercury, so thank you though. Okay, so you just want to concentrate on getting your material out from around the part of the tooth that wasn't prepped. Now, this is the most important part. The part that's prepped, okay? You can't just do this without looking in a mirror, okay? You need to have your mirror so that you can see your angles. When I start to do this, I'm going to have my Explorer start on part of the tooth. And it's at an angle. Can you tell? It's not straight like this. It's not down in. If you do it down in, you're going to ditch your margins. So keep it at an angle. This is why your band has to be high enough, because your tip of your Explorer has to touch the band. So you can do this motion several times. And what you're doing right here is you're smoothing and burnishing this cabo surface margin right there, okay? Then you're going to come from the other side and do the same thing, but you're only going halfway, okay? Halfway. And you can do that several times, but you can only do it if this is angled. So the tip of my Explorer is angled in a way that I'm trying to make this marginal ridge the same height as this one. So if I have it too straight, then the margin might be too high. That might be okay because I can always lower it, but if it's too low, there's nothing you can do once it started crystallizing and starting to get together. It's going to break if you try to add more or anything like that. So I'm going to suction this. Okay. All right, so once I've removed the excess from around the sides of the tooth, and I've come like this several times to make sure that margin is flush. This is still too soft for me to take out. Typically right now I would take the band out, but I don't feel comfortable with that. So I'm going to see if it's soft enough for me to sink my acorn in to make some nice fauces. So at this point, it is still getting some shape. So right here would be your distal fossa. So I can put my acorn in here. Do not force it. If it's not making an indentation, you'll just crack your amalgam. So you, at that point, you would have to carve it, okay? So let me show you. Get your very small discoid cleoid carver. Tell me I don't have one up here. You have a little small one. I'll just use this one. Thank you so much, though. So I'm using the point. You guys use your very small discoid cleoid. And what you would do is you go very, very gently, and with a fulcrum, you just go to the areas where you need, and you have that one. Perfect. Thank you. Right where you need that. And I'm basically just putting it here and just kind of pushing, and a very, very slight pull. And I'm changing the direction in which my carver's angled, okay? So remember, right here is where your central fossa should be, okay, for this tooth. And you want the central fossa to be deeper than the rest of the fossas. But when you're carving, you cannot carve into any of the walls or you are going to ditch it, which means you're removing the amalgam that needs to be there. Do you understand? Now this area is the most difficult area to carve right here in the mesial because that margin's there. So decide, first of all, maybe you might put a little line there, okay, and say, my margin's got to be this thick, okay, from here to the band thick. And so when I carve my fossa for this side, I'm not going to carve into that margin area, or else you're going to have a real thin margin, or even you're going to break it. Okay? So I can do this much when my band is still on. Okay? So see how I still have a marginal ridge there? You have to be very gentle, but you can use your cleoid, or discoid rather. Okay, so here's my distal fossa, and it's not finalized. I mean, I gotta fix them, but distal, middle, and mesial, okay? So make sure that you suction then to get the extra amalgam out of the way. So at this point, I think that it's set up enough. I'm gonna go ahead and take this, fingers crossed that since my band was loose, I'm not gonna be breaking my marginal ridge, but get your wedge out. At this point, this is why you have to have the open part of the Tafelmeyer retainer facing towards the vestibule, because I need to separate the band from the Tafelmeyer retainer. So if you're moving this Tafelmeyer retainer, whoops, a lot like I just did, and messing around with it, you're going to break your margin. So what I want to do is I want to gently hold the band and the guide channels with my fingers, and I want to loosen the outer knob that holds that band in, and then I'm going to raise it up and out of the mouth. And now I can remove the distal part of this band very easily because it wasn't prepped back there. And I'm going to straighten the mesial part of the band out and then gently rotate it out. You can use your fingers, but you want to keep the band straight and bring it up and out like that, okay? Now the very next thing that you need to carve, and this is one thing that the state wants you to know, is you need to make sure that you're carving the gingival from that box area, the gingival floor. So if you take your instrument, you want to use the side, this side right here of the instrument, not the point, because if you angle it this way, the point's going to go in and ditch out your margin, okay? You want to use the side here and put it in the embrasure and just kind of go up and down slightly. You can do that from the lingual as well. In and up and down slightly. Okay. Now this is an important part as well. To get the walls, the buccal wall here, okay, you're going to angle this so the point is touching the adjacent tooth, and then you slide it up. Now, depending on where the prep is, sometimes the prep's wide and it's clear out here, you know, but this one isn't. But I'm still going to do this motion from the gums up, having the point touching the adjacent tooth the entire time. So I'm basically using, you know, this part of the Explorer. So when your amalgam, just like your class 5, when your amalgam is still soft, you can use your Explorer to do this. But if it's hardening, which I hope it's not at this point, because you're not going to be able to make this flush if it's hardening. But that interproximal wall is when you would use your Hollenbach carver. And since this is a carver, you try to decide which side of this do I need. You could put this like this. You could put it straight in, and because of the angle, it would carve your wall really well and not ditch it out. So you could do this to both the mesial, the buccal and the lingual, okay? But this is very important. You need to make sure that's taken care of before you worry about anything else, because if this isn't flush, you're not gonna have an easy time getting it flush, okay? All right, so as far as the rest of the restoration, I'm just gonna burnish it a little bit more here to seal the margins. This is the trickiest spot right here, so be gentle in these areas. Okay, so I have not carved yet as far as the triangular ridges. Okay. So what I'm going to do is I am going to focus on my triangular ridges. I already have my fossa, so I'm going to carve down into the fossa for the distal side of my triangular ridge. Okay, and then I'm going to change direction, like I moved in my seat a little bit, make sure that the point doesn't go beyond this groove right here, and I'm going to carve the mesial side of the triangular ridge. Now as I'm carving, notice that the side of my carver is what's carving the walls. Can you do me a favor? Go up and tell the other students to come down here, please. Yeah. Then they can watch this. Thank you. So see how nice that looks right there? But you want to make sure that you're not carving from the walls. Be very careful. Make sure that you're putting the instrument right where you need it. That's called adaptation. And then you're activating it, okay? So I'm trying to make sure that this cavo surface margin all along here is flush, okay? So basically, at where I'm sitting, I was more comfortable to start with the lingual side. This is the transverse that I left here from carving my fossas. So I do want to carve a groove into the transverse, but I don't want to take it away, okay? Okay, so now to do this side, you may have to adjust your patient's head, ask them to please turn to the left. But again, when you start this side, you want to make sure that your point is going no further than the groove that you already left there, okay? Good morning, everyone. Yeah, this was taking a little longer than expected, so I figured you might as well come down and watch the recording. I'll do another demonstration for the class 2, get me an approximal area and all that stuff for you, but just finish this one out. So when you're carving this, you adapt your instrument exactly where you want it. Make sure you have a fulcrum. Angle the tip according to how deep you want to carve, okay? Make sure that you're always adapting it to tooth and filling so that your restoration is going to be flush. And we're carving, just this triangular ridge here first. And use the side of your carver, you guys. You're not supposed to scoop. And don't scoop like this. Don't ever carve into your margins. No matter what angle you're at, you adapt the carver different ways. And it should be like that for your class 1 as well. If you're not making your fossas deep enough, and your triangular ridge is correct, then what's going to happen is you're going to end up with high spots, right? Making sure that you don't have flash over your, or on top of your cava surface margin is so important. So right here, I have a margin left. I want to make sure that I leave this marginal ridge here. And the ridge has to be rounded like all of the other ridges. So sometimes I use my discoid cleoid like this, and since it's kind of rounded on this side, I just put it in here, and that will typically smooth that a little bit. Now, once you've done your fossas, if you notice once you've carved your triangular ridges and stuff that your fossas aren't deep enough, that's when you want to go back in there and create more depth. So here, this is the mesial fossa, and I want to make sure that it's a little deeper because I want to see a difference from coming from my marginal ridge. I want this to go down. I was just going to go over my margins here a little bit, make sure that they're flush and I don't have any extra. And when I do this, my instrument is always on tooth and filling. So I don't know if you guys have been watching your like more videos in your spare time, but I do recommend watching the other videos that are online for the different classifications, because there's different ways of doing different techniques. Just beware of carving with like your Hollenbach carver or something like that, because that could end up I don't think you're good enough to use that yet, and you could ditch something. I'm just going to go over my margins again here. You can make sure that your instrument goes up and down over transverse ridges. Now it doesn't hear very much, so I could carve this a little deeper. So that there's more of a ridge, see that? Just by carving that a little more. And then turn your patient's head, tell them to turn left or turn right if you need another angulation to try to see better or adapt your instrument better. Okay. And then your marginal ridge, you want to make sure that it's rounded. So just very gently round it right there. Floss on here anywhere. Could you grab me floss? There might be some in here in that little floss container. Thank you. When you guys are flossing, you want to make sure that, thank you, that you floss down and then scrape, make a C and scrape up and down over that gingival margin, okay? And then let go and pull out and go down several times. Bless you. You're welcome. Okay, go down several times now. Oops. I'm gonna give it a quick rinse with air and water. Little burst of Now this is important. I don't have a red paper here, but if you close, you want to close gently, you guys, and then tug on your paper and pull. And that should not mark anywhere, okay? So then you want to tap, 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 check again. Tap, and then you want to grind side to side. Check again. And now you want to go forward, okay, and check again. And I'm not really hitting anywhere, so that's awesome. So what I want to do then is I put a little water in my tray, whatever, and I wet this. So now I want to go over this just to make sure I have everything kind of wiped off. Now the last thing I'm going to do is burnish. If you're not using your instruments properly, then you're not going to get the right result. You see my burnishing? Thank you. Okay. Now it's hardened enough that I can use this smaller one and I can just lightly, you got to be careful when you're burnishing. You don't want to, because it's not going to be completely set up. So if you burnish too hard, then you could possibly, sink your filling material in. But what I want to do is I want to make sure that these margins are really, really smooth and I don't have flash anywhere. Okay. This marginal ridge is good. You want to try to burnish in here, like the linguals, you can see the lingual interproximal wall sticks out more than what the mesial does, so you want to make sure that that's flush and that you're burnishing that as well. So when you're finished, when we come to check your restoration, I want to be able to see ridges. I want to check the margins and make sure that they're all flush, okay? I like to put maybe a little groove in here. I thought I got you.
No, I'm good.
Okay. So now, if you can do, when you're doing your restorations, you want to remember, if you can't sink your acorn in because it's starting to crystallize and harden, then you have to use your very small discoid cleoid, which I keep losing. Thank you. Good thing Cece's over there. You want to use that and just get in there and make sure that you're not carving into any of the walls, okay? And number one, one of the most important things is to remember is that before you start carving your mesial, because this one was the only surface drilled through, when you start carving this, you have to put a line, draw a line like this is how thick my marginal ridge is supposed to be, and do not carve past that marginal ridge, because if you do, then you're going to end up making it non-existent, too low, okay, ditching it or something. So notice the height of the marginal ridge is the same height as the adjacent tooth. That's what you want, okay? First thing that you do when you take your matrix band off is you get your explorer and you go in between. Using the side of this, you put that in between and you kind of go up and down. Like they have papilla in there, right? So you got to be careful. You put that in between and go up and down using this flat side of your explorer. Do not ever angle towards or you'll ditch that, okay? And just remember that this right here is an occlusal embrasure. So you want this to be rounded. You want this margin to be rounded, just like these, how they're nice and smooth and rounded, okay? All right,